Thank you, Mr. Moderator, fellow TED listeners and TED speakers. When I was challenged with this presentation on pushing boundaries, I looked at veterinary medicine, and I also looked at my personal boundaries. My story starts in Taber, Alberta. When I was a toddler, I was a little bit shorter than I am now. I decided to challenge the roadway, and I toddled across the roadway. Our dog, Boundary, saw an imminent issue. There was a truck coming. So he bounded across and pushed me out of the way. That was where Boundary pushed me instead of I pushed boundaries. Fortunately for me, I'm still here. But everybody was very upset that I crossed the road, and Boundary is no longer with us. Later on, we had a white cat, short-haired white cat, 2 different colored eyes. And this one morning, she started meowing like crazy. Now, I can't match her meow because I'm not the ventriloquist, but she was just annoying. And we put food down for her, but she didn't want to eat. She kept walking back and forth to the back door. I got thinking, why? Am I talking to animals now? Well, I decided to follow her. She took me downstairs, and lo and behold, what was there? 2 newborn kittens. That's what she was trying to tell us. Now, we didn't stay in Taber. It's a small town in southern Alberta. We moved up to Edmonton. My dad had some health problems in Taber. So we moved to Edmonton. I went to the Strathern Elementary and Junior High School. When I was in elementary school, I was walking to school one day on a bright, sunny day, and I saw this dead cat on the side of the road. I walked over to it. I really looked at it. I thought, if it's still alive, what would I do? And I got thinking, I should take it to a veterinarian, but it's dead, so it doesn't have to go there. But if it was, maybe I wanted to become a veterinarian. I like sciences in school. So that gave me my inspiration to maybe aim for veterinary medicine. So then I moved on to Bonnie Composite High School. My first challenge when you go to high school is, okay, are you going to take 3 years of French or 2 years of Latin? Well, I really had an interest in an old language like Latin, and I thought it was more used in the medical profession, so I thought I'd do that instead. After a couple of years of high school, I was communicating with the veterinary college I wanted to go to, and I asked, what do they need? Because I really thought, well, they're going to need biology for sure. No. They wanted chemistry and physics. What did that have to do with veterinary medicine? Lo and behold, I decided to challenge that boundary. I took all 3. Well, that was the advantage I had, because by having all 3, plus I took an extra math in summer school, I got accepted. Now, when I got accepted, the acceptance letter didn't come to me right away. It came a week before I had to be there, just because it went to the wrong address. And then, at age 17, I was a little nervous about going 2,000 miles away for school. But it just so happened that summer, one of the veterinary students was working with my dad as a summer student. So I had coffee with him, and he said, hey, if you got picked, you go. Challenge yourself. Push that boundary. So I did. So at Ontario Veterinary College, it wasn't actually a university at that time. It was 3 colleges working together. But over the 5 years I was there, it became the University of Guelph. And that's when I became a veterinarian. Now, at age 22, my challenge, of course, was find a job. Well, I was interviewed by a couple people, but they said, you look too young, and you are too young, so we're not going to hire you. So I had to look around. Where'd I go? Toronto. Not Toronto, Toronto. If you live there, it's Toronto. I went to a couple companion animal practices there. I learned a lot about what they do in Ontario and Toronto. Then I moved on to Brooklyn, Ontario. Not Brooklyn, New York, but Brooklyn, Ontario. It's a small town, but we're just north of Whitby and Oshawa, so there's a lot of companion animals there as well. And I did most of those. My other 3 partners did the cattle and the horses. E.P. Taylor's farm was not too far away, so I got to look at some quality horses as well. But I did most of the work in the clinic, and the other fellows went out and rode. But I learned a lot about basics, because you're going to feed cattle and make quality cattle, you have to analyze the feed and find out what's in it and make sure it's properly balanced. Because you have milk-producing cattle, you have beef-producing cattle, and you want to have quality. Not everybody did that, but those that wanted it got it done. And this was way back quite a few years ago. Nowadays, it's almost routine. But then I had an irking to find my own practice. So I established the Bonnie Doon Veterinary Clinic and office. You notice that Bonnie Doon was in my high school name as well. So I was back to my alma mater. My clinic was in the shopping center where I spent more of my time, I think, than I did the school. Now, when I first started practice, I got a fair number of clients. I started thinking, maybe we should have a dog care course. So I approached Grant MacEwan Community College. I talked to a few dog breeders and dog owners and producers, and we had a dog care course. Unfortunately, it didn't last very long because a lot of people thought they didn't have to go to college to learn about dog care. They just talked to the breeder or whoever. So then I decided to write an article, get together with a newspaper client of mine, and wrote an article on picking your dog. Well, I had a little, and I didn't expect the whole article, a full page in the Edmonton Journal on picking your dog, and there was all kinds of charts there and everything else. The next thing I know, I get a phone call from National Enquirer, our favorite magazine, right? They read the article, and they wanted to interview me over the phone. So I said, okay. I asked them to send me a copy of the article, but they never did. But I was at a dog show, working at the dog show, and I talked to dog show people, and they said, oh, that was a great article. Now, this is all in BC time. That's before computers. Recently, I was looking through the computer, and I found out Montreal Gazette picked up the same article. So little did I know that I was getting very popular. A few years later, I got a visit from an Edmonton Journal photographer. Now, what would he be coming in for? He wanted to take some pictures of pets. I said, well, unfortunately, I don't have permission for clients' pets in the back, but you're more than welcome to take a picture of my clinic cat, Sasha. Well, Sasha was just sleeping all the time, so he wasn't too interested. I said, well, I'll talk to her and see if I can liven her up for you. So I pinched her tail a little bit, and that was it. So after he got the picture, I thought, what are you going to do with it? Well, we'll see. I'll give it to my city editor and see what happens. Lo and behold, I'm on the front page of the Edmonton Journal, Friday night edition, with a TV guide. This is a close-up picture of Sasha, how happy she is. There's no needle on the syringe, so you don't have to worry about me needling her at all. We took the needle off the syringe. But it was a picture that showed up in the Regina Leader-Post, as well as the Toronto Globe and Mail. So everybody obviously liked the picture quite a bit. Later on, one of my clients who worked for the Edmonton Sun approached me about doing an article on pet health insurance because she felt it was very important to communicate with the public. So she brought her dog in, and we did the article. Now, this is before computers, before the internet, so a lot of people didn't see this at that time. Now, as was mentioned before, my name is Dave Cartledge, and it's a unique name because a lot of clients thought it was really funny that a veterinarian would have the last name of Cartledge. I just accepted it as part of the package. But I was dealing with a drugs distribution center a few years back, and they brought a new product in they didn't want to market. And when they put it in the catalog, they used my last name. I said, oh, boy, I can get royalties. They said, no, we better change that. At college, they talked about connective tissue, that tissue that's underneath your skin. And they mentioned that if you really impact it hard, there's a lot of swelling takes place, and blood vessels get shrunk down because of the pressure. So you have low oxygen tension, a lot of pressure, and it converts into cartilage. And then my prof turned around and says, that's probably where he came from. But a lot of my classmates, they start seeing Cartledge all the time in their notes, and they looked at me all the time, and they said, you know, Dave, we have to change your name. We just get sick and tired of looking at your name all the time. So they changed it to ligament. But they said, Dave and ligament don't go together. We'll have to change that too. How about Charlie ligament? Well, all my friends know me as Chuck. So I now have an alias. Now, I brought in the idea of the topic of cartilage, ligaments, tendons, and joints just because it relates to everybody in the room, and it relates to your pets as well. We all have problems with joints and tendons from time to time. If we run too hard to catch that bus, or if we slip on the ice outside. And when we start to get into middle age, we start to feel those joints a little bit more. Well, there's been great boundaries pushed in the treatment of arthritis and joint disease and tendon problems in the area of pain, either subtle pain or real heavy acute pain or slowly developing pain. Pain medication. When I started practice, we didn't have good pain medication. We had a few, but very few, and the doses were very inappropriate. So we actually used human medication, usually bufferin, because straight aspirin caused stomach upsets, and then you'd have to clean up the mess on the rug from your dog or your cat. And cats, they're very sensitive to aspirin, so you can give those children's aspirin a half every other day. They can tolerate that dosage, at least some cats can. But a lot of people got confused between aspirin and Tylenol. Well, Tylenol is a different drug altogether, and it's a poison to cats. So I emphasize, if you're going to use anything, aspirin. But nowadays, you don't have to use any of those because they have side effects. They have now new medications that don't have side effects. A great boundary being pushed. Surgery. When I started practice, we did surgeries on knees, and we sometimes had to use the tissues of the animal and just kind of redirect it. Take a piece of muscle and redirect it a little bit and see if that would do it. Well, unfortunately, sometimes the tissue that caused the problem because it was weak and poorly nourished, it would break again just because of poorly nourished. Nowadays, they have artificial implants that don't cause reaction, but they actually support the body weight. But a lot of my clients started asking for alternative therapies. Do we have to do surgery? Do we have to go on this expensive pain medication? A lot of veterinarians actually are now doing acupuncture. Why? Because it's effective, it's inexpensive, doesn't have side effects. And more people, including myself, have had acupuncture and had great success with it. The other question is, how about a chiropractic therapy? Can you refer me to a chiropractor? Well, it just so happened in Edmonton at the time, I had a chiropractor that actually come into my practice and adjust dogs and cats on my exam table. That worked out great. And a lot of happy patients and clients. Glucosamine is another popular product now that's in a lot of medications. You sometimes have to find the right combination of glucosamine with whatever base product they're in to see if you can handle it and it does right for you. Elk antler bark has become popular as well. I had a client who actually had some relatives in that area, and that's what he used for his pain. Shark cartilage, as mentioned before. I was just at a veterinary conference recently, and they actually have now braces for dogs' legs. And they have wraps to keep them more comfortable. But a few years back, there was a magazine article that came out saying vitamin C is going to prevent hip dysplasia. Well, I could not believe that. Now, hip dysplasia is a malformation of the hips, where instead of being a good ball and socket joint, the ball is not shaped right, or the socket is, instead of being concave, it's more like a half moon. But we are doing an awful lot of x-rays of breeding dogs just to do line breeding so as we prevent hip dysplasia. But they said vitamin C was going to do the trick. Well, a client of mine came in one day and says she started giving vitamin C to prevent hip dysplasia. So I took to my chiropractor friend and I said, do you recommend vitamin C for people as well? And he said, oh, for sure, 2,000 milligrams a day. Really? Okay. Well, maybe I'll recommend it for some dogs and see. So a few clients came in with their older dogs and that they were having trouble walking across my lino floor. And I said, why don't you try some vitamin C and give me a phone call back and let me know how it works. You'd be surprised. Within a week, those older dogs became puppies. They were running up the basement stairs like crazy. One of my clients said, I'm going to start taking that myself. So since then, I've been talking to my clients, and many of my clients said they've never had an older dog healthier once they started recommending vitamin C, getting on a quality diet. I'm in Toastmasters as well. I started giving speeches in my Toastmaster clubs, and sure enough, a lot of people in the audience came back to me within a week to 2 weeks saying, guess what, Dave? I'm taking vitamin C now too, and it's just great. Even a truck driver in Calgary I talked to, he started taking it, he feels great. Their pets are doing great as well. Some pets are on medication, the expensive medications, the new ones. And they wanted to say, is there something they can do to kind of maybe reduce the cost? Can they give it every second day or something like that? I said, try vitamin C and see how it works. And they phoned me back and said, sure enough, they're reducing the dosage. And the cost is less, and their pet is very comfortable. So I challenge you to push your boundaries for your pets, and perhaps for you if you wish, to try vitamin C. It's very effective. May the powers be with you. Ms. Moderate.